In this episode, I answer a question from a manual therapist in Ohio who is struggling with getting results and properly communicating with their client that the treatment process will be slower due to their poor metabolic health. Expect to learn the following: recognizing all aspects of the injury presentation, not just the soft tissue, why treating a client with metabolic issues is more difficult and will take more time, a screening process I use to determine if I even want to take on a client with metabolic issues, how to properly address metabolic issues without offending the client. I hope you gain some new insights and perspectives from this episode. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach manual therapists a new treatment system that eliminates the frustration of not getting consistent results so you can help more people get out of chronic pain, all while working 50% less and easily doubling your income. If you're new to the show and you don't know who I am, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. All right, so when to address lifestyle and metabolic issues with your clients without making them feel bad. The question this week came from a manual therapist in Ohio. Just a quick reminder, if you have any specific questions you want me to cover, especially about business, communication, client education, marketing, and sales for your practice, then send me an email. And if I think my insights can help, I'll make an episode for you. All the information to do that is included wherever you're consuming this video. So the question was, I have been working on a client with neck and low back issues for going on about 3 months. Whenever I ask the client how they're feeling, they usually respond with about the same and come in deflated. The client is severely overweight, never exercises, and often smells like cigarette smoke when they come in. Not to mention, working on them takes a toll on my body. They don't seem to be getting any better and passive aggressively put all the blame on me for the lack of results. I want to be able to help anyone that comes in my office, but in this situation, I feel lost because I know the treatments are working, but the client's poor health and lack of doing anything between treatments is what is holding everything up. I'm grateful to have the business, but it continues to frustrate the hell out of me that they won't take responsibility for their health and keep blaming me. What should I do in this situation? Should I address the issue? If so, how can I do it without offending them, or should I just fire them as a client? So, a big thing that I did for years as a manual therapist was not recognizing all the aspects of the injury presentation. We tend to think it's always a tissue problem, maybe in the muscles and the ligaments and the fascia. Now, there's 4 components to the injury that we must look for every time. First one is just the tissue. And a lot of times I find problems with adhesion buildup or scar tissue or dysfunction, where it builds up in the muscle, makes it weaker, less flexible, finding the muscle, the ligament, nerve entrapments, fascia, everything like that. Another issue that presents in the injury presentation is structural components, specifically the bone, the cartilage, the disc, the tendon. Those are important as well. And a lot of times when people are getting severe pain, those areas are actually damaged as well because the tissue built up. The next one is a psychosocial component. Like, how is this affecting them mentally? How are they dealing with this problem? Are they the type of people that say, if I don't work out and run 50 miles a week and go to CrossFit and beat the hell out of my body, like I'm just going to lose my mind and go crazy? There are psychosocial components to that as well. And last is just their overall metabolic health. How are they functioning? How is their body producing inflammation? Does their diet suck? Do they not exercise? Are they stressed all the time? These are all components, and we must consider all aspects of this, because a lot of times, we want to take on a client and just be able to help them, but we completely ignore the elephant in the room. And it's funny, in this situation, the person is built like an elephant because they're huge. It's not being mean, just being honest and a little bit funny, but it's there, and we have to address it as well, because it is key. We must know all the components of the injury and not just focus solely on soft tissue, because this is what's going to keep you from getting the results you need, having good results for the clients, and really just giving them a good outcome, and being able to understand all the aspects and not just jumping solely into treatment, knowing what you're up against and what you have to do in between to make sure everything is going to just have the best results possible. Just a quick break from the podcast. Just a quick reminder, we do have some free training courses available that help you on the journey to becoming a solutions provider and getting to the root cause of the issue so you can avoid the frustrations of not getting consistent results and help more people get out of pain. Links to do that are included in the description below in this episode. So let's get right back into the episode. When you think metabolic issues, think inflammation. So one thing that I learned, instead of telling someone that they're unhealthy, I just say they have some metabolic issues. It's a nice way of saying they're unhealthy. So why treating a client with metabolic issues is more difficult and will just take more time. First off, is treating them is like treating someone wearing a comforter or a really big blanket. It's hard to feel the tissue. And if you can't feel it, you don't know where the tension is, you don't know where you're going. It's going to be hard and you're going to have to work a lot harder than you should. Next thing is it's just going to take at least 50% longer because you're not going to be able to access the tissues. They're not healing correctly. You can't do as much treatment because it's going to create more and more inflammation. And lastly, it's just harder on you as the provider. You're going to have to work harder. It's going to beat the hell out of you because these areas are big. If you're moving a big leg, a big torso, things like that, it puts a lot of wear and tear on your body as well. So what's a screening process I use to determine if I even want to take on a client that has metabolic issues? First thing that I do and what we teach in our system is do a consultation first to see what you're up against. I like to do these in person or over Zoom. It gives me a chance to look at this person, see what they're like, see if they're unhealthy, see if they're severely overweight. Do they smell like cigarettes? Do they not exercise? Things like that. It allows me just to screen them properly instead of just like talking them on the phone. I don't really know what's going on. And they walk in and they weigh 400 pounds and they expect me to fix their back pain or fix their neck pain in 2 or 3 visits when we got a lot of other problems in there. And a lot of things are higher up on the list, like the metabolic issues and the psychosocial issues. Next thing is understand that if you're for everyone, then you're for no one. It's okay to turn people down that you know that you can't help, because in this situation, if this provider would have just been honest with the person and not taken them on, they could have avoided all this frustration. Now the client's pissed, they're pissed, everyone's pissed, and it's not a good situation. Where if we could have just handled this properly in the beginning and had a real talk about what was going on and what was going to take, there'd be better expectations. Educating the client about what's going on, what you can do to help is just as important as doing the treatment. But so many of us just want to jump right into the treatment and just do a bunch of stuff, and then we wonder why the client's upset and not getting the results they want, which makes you dread having to treat them as well. Next thing is, you can still do decent work. It's very decent on neck, shoulder, and upper extremity. If a person is overweight, it's still hard to feel, but I will take on a neck or shoulder person and someone that's metabolically challenged, a little overweight. But it's still going to be difficult, but it's not as much if you're getting a low back. I got to be honest with you. I have yet to have a successful low back case in my 14 years of practice with someone that's metabolically challenged. I've taken them on before and it's always ended in not a good way, very similar to the question that came in this week. So I don't take them on at all because it's just going to be frustrating for everyone else. So say they do have metabolic issues and you want to be able to address them without being offensive to the client or offending them. We live in this society where everybody's offended and we shame them and all this stuff. It's like, no, let's just have an honest talk about what's going on. So first off is just be honest with them. They know they're unhealthy. This happened for me myself. I look all handsome and great now from where I am, but less than 5 years ago, I was about 100 pounds heavier than where I was. I was totally out of shape. I looked like crap. I was miserable. My joints hurt. But everyone always told me, they're like, well, you're just big boned. You played football. You're just carrying along a little extra weight, just a little chubby, but nothing too bad. Finally, my mentor was just honest with me. And he said, you know what, Matt, you're just very metabolically challenged. You're unhealthy and it's going to be bad for you and your clients aren't going to take you seriously. That's what I needed to hear. He wasn't a jerk about it. He was just being honest. So just be honest with them. Next is take the time to explain to them the role of inflammation and why it's just going to take longer to heal. Inflammation just messes everything up. There can be problems in the healing process. They can't handle as much treatment. It's just going to take longer. If you're at least honest with someone, like if you tell them that it's going to be fixed in 1 or 2 visits, but it's not, and you didn't tell them that, they're going to be pissed. But if you say, hey, based off your metabolic issues and the inflammation that I'm seeing, this is going to take 50, 60% longer than it normally does. You just have that conversation and you're honest, and they'll appreciate you being honest with them and letting them know what's going on. And lastly, and I think this is the most important thing, is don't tell them what to do to help. Instead, say you've been able to help yourself or maybe other clients significantly reduce their inflammation, and ask them, would you be open to me sharing some of those ideas to help you in the healing process? You're not telling them what to do. People don't want to hear what to do. You can just say, this is what I did and this is how it helped me or helped other people. Would you be open to me sharing a few things like that? It will make the conversation go a lot smoother. So just to recap, first off, recognize all the aspects of the injury presentation. It's not just the soft tissue. There's structure issues, there's psychosocial, definitely metabolic issues. When you think metabolic issues, think inflammation. It's really hard to treat clients with metabolic issues. It's going to take more time. Screen them like I do the consultation, ask questions, and be picky about who you take on, and only help those that you know you can truly help. It's going to be better for everyone else, for your practice, for your business, for your own mindset when they come in. You're not going to dread this client in wondering what they're going to say. And when they say, oh, it's about the same, it just pisses you off and you're pissed off, and it's not good for anyone else. And lastly is just address it properly, be honest with them, explain the role of inflammation, and then share with them things that you did to help or you helped with other people. It's going to be in a much better conversation, put you in a better place, not piss people off, and hopefully just be good for everyone involved. So that's all I got for you guys on the episode. I appreciate you guys watching. And as I close every episode each week, go out there and be great this week. The world needs access to your amazing soft tissue treatments so they can stay the hell away from pain pills, injections, and surgeries, which only make things worse. I appreciate you guys listening and watching, and I'll catch you on the next one. Bye.